Hello everyone, my name is Crystal Morakesada and I would like to present silent compression, low consequences, Thurner Syndrome, a recurrent deep venous thrombosis in a young adult with sedentary lifestyle and vaping exposure. Thurner Syndrome, or iliac vein compression syndrome, is an unrecognized vascular condition in which the right common iliac artery compresses the left common iliac vein against the lumbar spine. This anatomical variant predisposes patients to iliofemoral deep vein thrombosis. Traditionally, we think of this syndrome in young adults, but what makes this case especially interesting is how modifiable risk factors, including obesity, prolonged immobility, and even vaping, can amplify thrombosis risk by promoting venous stasis, endothelial injury, and inflammation. Our patient is a 26-year-old obese male, a former smoker who continued daily vaping and who worked long sedentary shift as security guard. He presented with several days of worsening left leg pain to the point that he could barely walk. Imaging confirmed extensive iliofemoral deep vein thrombosis. An initial attempt at thrombectomy was unsuccessful because of complete femoropopliteal occlusion, so he was started on anticoagulation with heparin. The vascular surgery team then identified Thurner Syndrome as the underlying anatomical culprit. A second thrombectomy was performed via internal jugular access, followed by placement of the left iliac vein stent. Unfortunately, within 48 hours, he developed rethrombosis of the stent and surrounding veins. A full hypercoagulable workup, including antithrombin 3, factor 5 latent, prothrombin mutation, ANA, and antiphospholipid antibodies, was negative, essentially ruling out inherent thrombophilia. This case highlights the multifactorial nature of DVT in a young adult. Thurner Syndrome provides a mechanical obstruction, but his lifestyle choices, chronic vaping, and prolonged immobility likely worsened endothelial dysfunction and systemic inflammation. Emerging evidence suggests that vaping impairs vascular reactivity, increases oxidative stress, and activates prothrombotic pathways, all central components of virtual triad. In other words, this patient's anatomy and environmental worked together to create the perfect storms for thrombosis. From management standpoint, treatment of Thurner Syndrome related to DVT often require a combination of thrombolysis, thrombectomy, and iliac vein stenting. However, as this case demonstrates, stent failure and reocclusion remain a recognized risk, particularly when underlying behavioral or inflammatory drivers persist. In conclusion, this case underscores 3 key teaching points. First, always consider Thurner Syndrome in a young patient presenting with unexplained or recurring left-sided iliofemoral DVT, especially when thrombophilia testing is negative. Second, prime recognition by vascular team was vital to diagnosing and addressing the true anatomical drivers of this patient thrombosis. And third, modifiable lifestyle factors such as immobility, obesity, and vaping should not be underestimated. Addressing these risk factors is essential and not only to preventing recurrence, but also for improving long-term vascular outcomes. In summary, this case highlights the value of a multidisciplinary approach where early anatomic recognition, appropriate intervention, and aggressive risk factor modifications work hand in hand to improve patient care. Thank you so much for your time and have a wonderful day. Hello everyone, my name is Crystal Morakesada